Hello people, this question on geriatrics is very important in community medicine. Okay, what is geriatrics first of all? Geriatrics is the science dealing with the study of diseases and the treatment, particularly to old age. The diseases related to old age is called as geriatrics. This is geriatrics. Say that it is a science, okay, it deals with all this. Then they will ask you what is the size of the problem. Let us see the size. Guys, what they say is in Italy and Japan, they have the highest proportion of old persons in their country, okay? But in India, it is not that much of old people. Anyways, do you know the life expectancy at birth? 70 years. But what is it in India as of now? Look at this. Life expectancy at birth is currently 69.4 for India. Isn't it? 69.4. So you should mention all this. Life expectancy at birth is 69.4 in India. So people live up to that age. Because of advance in medical science and improved social conditions, the life expectancy has increased. So what else can you say? So number of old people will keep increasing, right? And that too with the birth rate declining and death rate also declining, right? So old population will be more. So we have to address these issues. What are the health problems of the aged? Here they are talking about some very, philosophical things. They are saying nobody knows when old age begins. You don't grow old just by living to a certain number of years. You can age at any time, right? So it keeps happening. It's a slow and ongoing process and nobody can escape it, right? Here they are saying one thing, guys. Old or whatever age is just a number, but the term senescence, when they are saying senescence, is an expression which is used for deterioration in the vitality or the lowering of the biological efficiency that accompanies aging. So aging is good. That's what they are trying to say. But senescence is a word that they are using for this deterioration. Okay. So guys, the problems due to aging process, some of this they have listed here. Look at them. So they should develop senile cataract, right, in the eyes, cataract, glaucoma, that is again optic nerve damage due to raised intraocular pressure, visual field defects, nerve deafness, hearing problem they could have, osteoporosis affecting mobility, right? Are you getting worried? But look at these people, they are so healthy, so don't get so worried. Osteoporosis which affects their mobility, emphysema, right, that is referring to the lungs, let's say. Failure of special senses. So special senses means what? Taste and all that will not work, is it? Changes in mental outlook. So their perspective also kind of changes, looks like. And if there is long-term illness, then what exactly happens? There can be degenerative diseases of the heart like atherosclerosis. They can have ischemia, myocardial infarction, right? Cancer, especially breast cancer, prostate cancer. Accidents, they are prone to, because of osteoporosis, they are so fragile that they can fracture themselves even in home. Like the femur can get fractured easily. Diabetes, they said something about diabetes. Wait, they said it's a leading cause of death, actually, diabetes. Diseases of locomotor system, when it affects their muscles and all that, right, or their joints, they have a lot of discomfort. They're saying they're more unhappy with this locomotor system, like myositis, neuritis, gout, rheumatoid arthritis, osteoarthritis, spondylitis of spine. What they are saying, the textbook says that these conditions cause more difficulty and disability than any other chronic disease. Interesting. Okay. Then coming to respiratory illnesses, you will talk about the lungs. What will you say? Chronic bronchitis, asthma, emphysema. Genitourinary system, you can say dysuria, nocturia, right? Enlargement of prostate, and frequent and urgency of micturition, right? So they will feel like urinating more times. And they have urgency of micturition. They want to pee in the night, right? Dysuria. Dysuria is difficult to urinate. Now let's come to this one, psychological problems. So we are looking at all the bad things in this slide. Psychological problems. What can they have? Psychological problems. Psychological problems now. Let's look at this. I don't think these people have any psychological problems as such. Okay. Psychological problems, they have mental changes. What mental changes will they have? What do you think are the mental changes in these people? Mental changes, they are saying like they have impaired memory, rigidity of outlook, dislike of change. They don't like change. Okay. So that we can understand. Who likes it anyways? But this one is bad, right? Impaired memory. And they dislike change. Rigidity of outlook. What is that? Reduced income leads to fall in the living standards. So their living standards fall. Okay? So they don't like that. And sexual adjustment. What is the sexual adjustment? We are looking at what? Psychological problems of the elderly. So here, sexual adjustment, they are saying that between 40 and 50, there's a cessation of reproduction by women and diminution of sexual activity in men. So they have a lot of disturbances, irritability, jealousy. Wow. So there is cessation of reproduction by women, diminution of sexual activity. So, okay. So that's a nice word they have put here. Let's take that word and put it here. What is the word? Jealousy. Jealousy. Emotional disorders, but they didn't put that in mental change. Okay, emotional disorder. Guys, listen to this. Okay, emotional disorder, because social maladjustment will be there. Okay, social maladjustment. So they're telling here a lot of things. Failure to adapt will result in bitterness, inner withdrawal, depression, weariness of life, even suicide. Suicide is the stupidest thing, because the pain that death gives, life is really not that painful. Death is really painful. Okay, let's go here. Our problematic slide is over. Okay. Now we have to go to the solutions. Healthy aging, disease prevention. Let's look at all these good things now. So guys, when we are coming to what can be done and how to keep everything good, look at this: diet and nutrition, exercise, weight. You have to check their weight so that they don't become obese. Smoking, alcohol, all this, stop. Social activities should be there. So basically we are giving a how to improve everything, right? That's what we are suggesting here. So what will you say for diet and nutrition? Don't take excessive fat, etc. Exercise, what will you say? Moderate exercise, not too much, not too less. Weight, you have to take weight check, you have to do. Obesity and all should not be there. How will you control weight? By lipid, cholesterol, what you eat, saturated fats, etc. Smoking, don't smoke. As simple as that. That's what you will write. Alcohol, beyond a specific amount, it will cause disease. So they are saying what? You should drink or you shouldn't drink. Just tell them that, alcohol will lead to liver diseases, etc. and discourage the use. Social activities. See, people who are not having friends, they are less healthy, it seems. So you should have more friends. At least, companionship. That's what is important, right? Where are we here? Companionship, at least they should have. They'll be more healthy. Okay. Guys, now we are coming to the most important part of this video. Okay. See, pay attention here. See, we started off here, right? Size of the problem, health problem of the aged, all these diseases and all you will write. This diet, nutrition, all this you will write. But this one is very specific. You'll have to write specific terms here. So pay attention here. Health status of the aged in India. So you will say life expectancy at birth is 69.4 years. So we have a growing aging population, right? So in 1999, they had a national policy on older persons. So you'll have to write all this history also. National policy on older persons in 19 Jan 1999, they had a policy, Government of India. So this policy, you write everything, okay? It covered financial security, healthcare, nutrition, shelter, education, welfare, protection of property, life, everything. Write this, okay? So this is just a policy. To implement this policy or something, they have this National Council for Older Person. So what will this do? They will operationalize the policy. What is NCOP? National what is this? Council for older persons. Okay, these people will operationalize the policy. Okay, very good. Then, so they keep revising these. Yes, we know any scheme is there, they'll keep revising this. So they will promote a society for all ages. So all ages should have, the society should be for all ages, just not for young people, right? Empower and improve the quality of life for older people. All that you will write. Okay, then. So basically various voluntary organizations. Okay, what will they do? They will form self-help groups for these people. Association of older persons for advancement of their rights and utilization of their experience and services. Association of older persons. Okay, then they have old age homes. They have given a number here, but I think these numbers like old age homes could be different in number, I think. Okay, daycare centers are there. Interesting. Look at this daycare center. You will be dropped in the morning to that daycare center and picked up in the evening. Wow. Like a baby. Daycare center. Okay. Mobile medical units. Okay. Then what do you have? They have scheme of assistance to Panchayat Raj institutions, voluntary organizations, self-help groups for construction of old age homes. Okay. So that's what they are saying here. Then what are we looking at? In India, how the elderly are taken care of. Okay. National Social Assistance Program. You have old age pension is being provided to many people. Old age pension is being provided to more than 4 million destitute elderly all over the country. The amount of pension varies. Okay. In Assam, they're giving only 75 rupees per month and they're giving 300 rupees per month in West Bengal. What will 75 rupees per month get that person? Anyways, okay. Then there is this old age social and income security OASIS project, guys. Old age social and income security project. What does it say? OASIS is old age social and income security project. Okay. Why did they launch it? To examine policy questions connected with old age income security. Oh, they launched it to question something. Examine the policy questions. Okay, okay. You yourself can think of something, there is something called as a senior citizen card, etc. Those people who have senior citizen card, they will get some transport concession, right? Travel related concessions, right? Where and all you will get in local government buses and then in Indian Railways. But they should have the card which says their age, right? Indian Railways, then Indian Airlines also. Indian Airlines and then state transport corporations. That is only this one. State government buses. We already said that. Then you have to mention these points, guys. If you don't mention these specific points, especially this health status of aged in India, you will not get marks. So what is it? National Policy of Older Persons, January 1999. NCOP, National Council of Older Persons. Voluntary organizations, National Social Assistance Program, Old Age Pension, Old Age Social and Income Security OASIS project. Then all this, they'll have this senior citizen card and travel related concessions. Senior citizen card. As of now, senior citizen card in India, what is the age? If they are above 60, they will get this card. They can apply earlier itself and they can avail it as soon as they become 60. Then there are some more schemes you have to write here. Healthcare is being provided to older persons through Bhavishya Aarogya Mediclaim, Bhavishya Aarogya Mediclaim, and rural group life insurance schemes. I'm not sure if this is under this. Okay. Mediclaim, right? Rural group life insurance schemes, right? Bhavishya Aarogya Mediclaim. What is this? Healthcare. How will they get healthcare? Bhavishya Aarogya, BAM, Bhavishya Aarogya Mediclaim, Rural Group Life Insurance Schemes. All these are coming under healthcare. Okay. Rural group life insurance scheme. Rural group life insurance schemes. Very difficult to remember these names, right? Say them. Bhavishya, Aarogya, Mediclaim, Rural Group Life Insurance Scheme. Also, if they keep their FD or like banking, they will get increased interest rate, right? Interest rates in bank they will get. Then they'll get income tax concession, right? Going in for a little more specific, guys, focus Indira Gandhi National Old Age Pension Scheme 2007. This was the pension scheme. IGNOAP looks like. Indira Gandhi National Old Age Pension Scheme. Do you know at what age Einstein died? I think 74 or something. No, guys, he died at 76. Okay. No relevance here, just simply trying to keep your mood awake. Then we have, yes, in this Indira Gandhi National Old Age Pension Scheme, the central government will provide monthly pension of 200 and state government has to contribute equal amount. So they will get 400, is it? Central plus state contribution. Okay. The person will get 2 contributions. Then, Help Age India. This is Help Age India logo looks like. This is the largest voluntary organization working for the cause and care of the disadvantaged older people. Okay, it is there from when, 1978. So it is a really, really old organization. So these people have many projects in that they have free cataract surgery. Then they have mobile medical care units. They have income generation, micro credit they will give, looks like. Old age homes they develop. Then there are daycare centers. Adopt a Gran is something that they have. You can adopt a grandparent. Nice, right? Disaster mitigation also they do. So what and all they do? Free cataract. It's a largest organization, remember. Largest voluntary organization working for the elderly. So what and all they do? Free cataract operations, mobile medicare units, income generation, microcredit, old age homes, daycare centers, adopt a grandparent you can adopt, disaster mitigation. This adopt a gran, I really wonder how it works. It's a legal way of adopting somebody. That's nice, right? Okay. And I hope this adoption actually is some adoption where the person takes care of them and it's not just something that you pay and make them be taken care of. What do you think, guys? Big talk? Okay. We're almost done with this video, guys. We just have to cover this implication of the aging population in terms of preventive and social medicine. Potential for disease prevention. We already covered this disease prevention, remember? Primary prevention, secondary prevention, tertiary prevention. We already finished. We just have to look at only one more point. Nice, right? Implication of the aging population in terms of preventive and social medicine. Guys, you know that there is something called as an age pyramid, right? So how an age pyramid will be in a developed country, in a developing country. See, if there's youthful population, how the pyramid will be. If there is aging population, how will it be? If there's already aged population, how will it be? How do you actually read this graph? Let's see. See, youthful population, young people are more, is it? And old people are really less. But in aged population, young people, so birth rate is less. Looks like there are fewer people here. And this part is kind of more. 70s people are more. Even 40s people are more. Okay. Actually, they are saying here something very negative, like aging population is a problem and all that. Then they are saying another thing like the old must continue to take their share in the responsibilities and in the enjoyment of the privileges, and they should take their rights and live it and all that. See, they are telling here the community must assess the aged to fight triple evils. What are the triple evils of this aged, Poverty, loneliness and ill health. Sorry. Yeah, poverty. Yeah. What and all are these problems that these people will have? Poverty. I think poverty somehow they can tackle, but loneliness and ill health is more difficult to tackle. What do you think? Okay. They have to tackle these 3 Triple evils. What are the triple evils they have to tackle? Poverty, loneliness, and ill health. Poverty, loneliness, ill health. Okay. Which one are you more scared of when you are old? I would be scared of this one. Ill health. Okay. That's it, guys. We are done. So potential for disease prevention, if you want to recap, remember, you have primary prevention. Tell them to reduce smoking, alcohol, take exercise. Just don't let the disease itself come. Take these vaccinations, etc. Secondary, if you have, always go for screening, get your blood checkups, everything. Catch the disease early and diagnose and get a treated. Tertiary, what they said is rehabilitate them, give physical support, functional, whatever they need support, cognitive, and there could be a caretaker, but make sure that they can live life without a caretaker. That's all for now in this video. We are done with preventive medicine and geriatrics. So basically what they wanted to tell here is what is the size of the problem, health problem of the aged, list all the diseases on earth, and list the psychological problems also. Basically aging is not a problem, but senescence is a word used for the deterioration in the vitality. So that is a kind of a negative terminology, you can say. Then how to improve their life, diet, nutrition, exercise, weight, stop smoking, stop alcohol, have some nice social activities. And then health status of the aged in India. This is the most important slide here. The life expectancy at birth in India is 69.4 years. In 1999, there was a policy, national policy on older persons. Then to implement this policy, they had a National Council for Older Persons to operationalize this policy. There are various voluntary organizations which provide self-help groups, association of older persons itself. They themselves have an association. Old age homes are their daycare centers, mobile medical units. Okay, guys, focus. We are looking at health status of aged in India. National Social Assistance Program. Social actually means a little money actually here. Old age pension, social and income security, OASIS, Old Age Social and Income Security Project. Senior citizen card, they can get above 60 years. They can have travel related concessions and government buses in the railways, in the Indian Airlines, etc. They have insurance like for healthcare, they have Bhavishya, Aarogya, Mediclaim, they have life insurance like rural group life insurance schemes. Banking, they get increased interest rate for your fixed deposits, etc. They have income tax concession also. Then there is IGNOAPS, is it? Indira Gandhi National Old Age Pension Scheme 2007 for the state and central both give contribution. Just look at this one thing here. This National Social Assistance Program, under it itself, this Indira Gandhi National Old Age Pension Scheme comes. There is also something else also called as Indira Gandhi National Widow Pension Scheme, Indira Gandhi National Disability Pension Scheme. For disability and for widows, they have something extra. Then they have National Family Benefit Scheme and Annapurna Scheme. Okay, so all this you can mention. Then lastly in India, you mentioned Help Age India. As we are moving on to the last thing here in this slide, health status of elderly in India. Help Age India, this one. You can see this free cataract operation. This is the largest voluntary organization for the elderly. I think in India, free cataract surgeries, they do mobile medicare units, income generation, micro credit they will give. Old age homes, daycare centers they have. Then you can adopt a grandparent. Okay, adopt a grand. Disaster mitigation. Disaster mitigation is a strange thing that is there here, right? Under Help Age India. Is this disaster mitigation something to do with older people or just any disaster they are mitigating? Interesting. Let's move on, guys. Implication, why is all this so important? You should understand this population pyramid and how it affects the economy, etc. And the community must assist the age to fight this triple evil. The three evils are poverty, loneliness, and ill health. Okay. Then potential for disease prevention. You can do primary prevention, secondary prevention, tertiary prevention. Primary prevention, mention that they should stop smoking, alcohol, take immunization, etc. Secondary prevention, basically you will catch the disease early, so they have to go for screenings and all that, and diagnosis tests and all that. And tertiary, what you will prevent by doing disability limitation, rehabilitation. All those things you will write, no doubt, right? So this covers this topic, preventive medicine and geriatrics. Okay, that's all for now, guys. This is a very important topic for your exam. That's all for now. Bye bye.